First case 1, I'm just giving you the histology. What do we see? Got this big space that's kind of open. Got a few of those. The cells look kind of super monotonous. They're kind of overlapping each other too, which I think is helpful. You got this stuff that's got this kind of pinkish concretion in it. So what diagnosis would be most likely here? Are you takers? So I showed you these hemangioparasitic vessels. I showed you these spindle cells and that storiform pattern with something that looks like a really poorly differentiated epithelial element. So that's a synovial sarcoma. All right. Next case. One picture. This is all you get. Pretty discohesive looking cells. Got that line of nuclei at the periphery of that nest. So you might pretty quickly get to the diagnosis here. But the trick is, which of these translocations is most likely to be in this tumor? So you have to come up with the diagnosis first. And if you see that pattern that looks like a picket fence at the periphery of the nest, and that kind of cells kind of falling into the middle like an alveolus, you might get to alveolar rhabdomyosarcoma really quickly and be very excited. Yes, it's alveolar rhabdomyosarcoma. So now you got to figure out what's the translocation. Is 1122, 113, X18, or 1221? I'll give you a second. I think we might get a taker on this one. So take a guess. First one, second, third one, fourth one. And I know I'm several seconds ahead of you in the live stream, so some of this delay is the lag for the stream. Yeah, it's 113. That's very good. So you remembered from our talk about fusion positive rhabdomyosarcoma, the most likely fusion is either 113 or 213. 1 plus 7 is 8, so that's PAX7 on chromosome 1, or 2 plus 3 is 5. PAX3 on chromosome 2, fused to FOXO1 on chromosome 13. Very good. All right, case 3, again, just H&E, broad fibrovascular cores, monotonous round to oval nuclei, pink frothy cytoplasm, and some of these darker angular looking nuclei throughout here. Here's CD99. Which diagnosis is most likely? So would you call this Ewing sarcoma, synovial sarcoma, desmoplastic small round cell tumor, or a Ewing-like sarcoma? And hopefully none of you are thinking about calling this a Ewing-like sarcoma, because you know that Ewing-like sarcoma is no longer an appropriate term for any of these diagnoses. So it's going to be one of the first three. Anybody take a stab? Ewing sarcoma, very good, sir. Yeah, it's beautiful, frothy cytoplasm, monotonous nuclei. And again, I think that darker angular cells at the periphery of the nuclei, periphery of the nest is a really, really helpful feature. Case 4. All you get is this solid blue with these tingible body macrophages. What's the most appropriate classification? What's the prelim you're going to give your oncologist before you see any of your stains? Burkitt, yeah, I think Burkitt is a great thought, but I think I actually might say highly proliferative lymphoma. Favor Burkitt. I need to figure out on IHC and flow what this is, because like I said before, that presence of tingible body macrophages, that just tells you that it's a very highly proliferative lymphoma. You can definitely see that in a lymphoblastic lymphoma. I actually saw it in Ewing sarcoma once too. Anything that's really highly proliferative is going to attract those tingible body macrophages. If you say Burkitt, you're going to be right probably 99 times out of 100. But I think it's always thoughtful to articulate that this could be still could be ALL. This could be acute lymphoblastic. We gotta wait and see how flow and immunohistochemistry shake out. All right, number 5 is a teenager with a neck mass, also noted to have a large abdominal mass. So here's the neck mass that was biopsied. Pretty homogeneous looking. Here's some desmin, maybe dot-like. Here's some keratin. Here's another area of the tumor. Same tumor. Here's the amino terminus of WT1. Here's the carboxy terminus of WT1. What's your most, excuse me, what's your most likely diagnosis? I'll give you a second to digest that because that was a lot of information. So the trick to this case is that even though there's desmin and keratin, you have this area right here. And you have epithelium, blastema, and stroma. And you have reactivity for both of the WT1 genes. So this was pointing at the wrong screen. Epithelium, stroma, and blastema. Yeah, that's a metastatic Wilms tumor. So that what's really helpful is that histology. Like I said, that triphasic histology. That's all you need to know that this is a Wilms tumor. And the WT1, if this was something like desmoplastic small round cell tumor, the N-terminus would have been negative. But we don't have that antibody available anymore. It's an old case. So it's still a lot of fun to think about, though. So this is indeed a metastatic Wilms tumor. Our case 6, this patient's got tumors in the kidney and throughout the peritoneum. Somebody said carcinomatosis when they looked at the imaging, and then they took this biopsy. Nests of these kind of blue cells, lots of this desmoplastic looking stuff. Still some pretty solid areas, though, that I would argue are quite round, oval, monotonous. Oh, maybe even some sneaky darker angular cells flying in there too. But for the most part, this is nests and desmoplasia. And here's our pancytic keratin, really strong. Desmin, really strong. Desmin's got that nice perinuclear dots to it. You can see some of these areas next to the nuclei that are dot-like. And here's the amino terminus of WT1 is negative. The carboxy terminus is positive. So what's the diagnosis? What's the most likely NGS finding in this tumor, given this immunohistochemical pattern and this histology? Yeah, this is desmoplastic small round cell tumor, exactly. So the most likely NGS finding is going to be the EWSR1 WT1 that's characteristic of desmoplastic small round cell tumor, and that immunohistochemical pattern I showed you is because that C-terminal antibody is only available to react with the C-terminus of WT1. It lacks the immunoterminus. All right, we have made it to the end. You have passed the quiz. You've seen all the cases. Thank you so much for joining. Appreciate all the questions and participation.